Hello, I'm Dr. Dennis Lumumba, and as we celebrate Men's Health Week, today we're going to be talking about the prostate health, particularly on prostate cancer. Basically, in simple terms, it is cancer originating from the prostate gland. It can affect the prostate itself and just be localized around that area, or it can spread like any other cancers or other malignancies that usually spread. Mostly for the prostate cancer, it spreads to the bones and the bladder and the rectum. The most common risk factor is age. As you age, as you get older, you get the risk increases, especially past 50 years in comparison to when you are younger. The second risk factor is your ethnicity. Prostate cancer is very common within Africans, so your ethnicity does affect. Another risk factor is family history. When you have a relative who has had prostate cancer before, the risk is usually higher, especially if it's a first-degree relative. We also have lifestyle being a risk factor. This includes history of smoking, diet, lack of exercise, or sedentary lifestyles. For early on prostate cancer, you'll notice that you have an increased urgency to urinate more than normal, especially at night. You can also see blood in your urine or in semen. You can also have new onset erectile dysfunction. That's another symptom that comes on with prostate cancer, which makes it a stigma in most cases and makes men shy off from actually presenting to the hospitals. Another symptom is pain around your pelvis or your back. You can also have pains around your bones, that's on your legs, on your spine. So bone pains is another symptom that can present, but mostly this one is seen in late presentations whereby the disease has advanced. For screening, we usually have 3 tests which are done, but most commonly we use a prostate specific antigen test. That's a PSA test, which is just a blood test, not invasive. This is usually combined in our setting with an examination, a physical examination from the doctor, who is also going to examine your prostate and see if it has any features showing that it has cancer or it's malignant. We also have ultrasounds done to the prostate and a prostatic ultrasound done to evaluate the prostate and the size of the prostate to help in screening. Depending on the result of those tests, you are advised or referred to a specialist, a urologist, to review you. You can also have a biopsy done or an MRI in some cases to help in the diagnosis and staging of the cancer. No, the good news is that prostate cancer is curable and treatable, and even with early stage whereby it metastasizes and it's spread to other organs, we've made advances in healthcare whereby it can be treated. For treatments includes surgery whereby the prostate is removed if the cancer has not spread, hormone therapy for the same as it is very sensitive testosterone. You can have chemotherapy and radiotherapy. What can you do about prostate cancer? One of the things is ensure that you go for screening. Number 2 is healthy lifestyles. You need to consume a lot of fruits and vegetables which have antioxidants. This also helps in prevention of a lot of cancers that we see. 3 is exercise. Obesity is one of the risk factors for most cancers, including prostate cancer. Exercise helps reduce this risk. Moderate activity. You can be brisk walking at least 3 days in a week. Create awareness among men. This is a disease that's shunned about. It is a disease which has a lot of stigma with it because of the symptoms it has. For screening, you can visit any of RFH healthcare branches for the PSA test. RFH Specialist Hospital is offering the screening for free. You can also be on the lookout for the newly opening oncology center from RFH Healthcare, which is going to be having lutetium therapy. This will be the first of its kind in Africa. It's a radiotherapy treatment which was licensed in 2022, so it's a newly modern treatment modality and it is going to be a life changer in our setting. So keep an eye out. Let's create awareness on prostate cancer and eliminate the bias. Thank you.